Okay, I'm going to do something a little bit different today. It's called adhesion-related disorder. Now, this isn't an immune condition, it's not a neurological condition, it's none of that, but it is something that matters to me, purely because it's something that I have. It's something that is a condition that I suffer with. It's also a condition that's something that a lot of other people have to sort of live with, and it's not very well talked about. It just isn't. It's, yeah. See, everybody knows that surgery is very, very dangerous, and that the more surgeries you have, the more the concept that if you have a lot of surgeries, it can lead to a lot of issues. This is one of them. If you have somebody who has a lot of, especially things like abdominal surgeries or even pelvic surgeries, and there's a lot of complications that come with it, they're at risk for something called adhesion-related disorder, or even getting something called adhesions. And it is blatantly scar tissue, but it's scar tissue that just doesn't do its job properly. That is all adhesions are. Adhesions are something that naturally grow as your body heals from surgery. But they grow in addition to the scar tissue that's supposed to be healing you. So every time you have any kind of major surgery abdominally or in your pelvic or abdominal surgery, as you're healing just about where you have surgery, you end up with a scar because it's natural and it's normal. But if it's major surgery or there's a lot of surgeries, adhesions will grow alongside it. And it happens a lot. It just does. Up to 93% of people who have had abdominal surgery get adhesions. And all it is it's a band of scar tissue that joins two internal parts of your body together. Only they're two internal parts of your body that should never have been joined. And it's usually either your organs or just other scar tissue. And it's, yeah. Normally, it can present itself in two ways. It'll either be like a thin sheet that will just sort of band across it, or it'll be like a thick, fibrous kind of band around it. But it joins two parts of your body together internally, either an organ, two organs together that should never actually join, or just two pieces of scar tissue together. So 93% of people who've had abdominal surgery will have this, and 10% of people who have never had surgery ever, for some bizarre reason, will also end up with adhesions. I'm not quite sure how it works, but it's true. Okay. Now, adhesion-related disorder actually affects a lot of women, because it affects the reproductive organs specifically. Also, it does affect males as well, because it also affects things like the bowels, and it can affect the heart area, along your spine, and your hand. Although I've not actually understood how it can affect your hand, because it does specifically state it's through surgeries but I'm assuming if you have enough surgeries in that area, it'll affect that too. Though I couldn't find why it affects your hand. There are specific risks to this, and it is to do more with what kind of surgeries you've had and why you've had those surgeries. If you've had things like major surgery or multiple surgeries, you're at really high risk for it. If you've had these types of surgeries and you've got post-operative complications, and it doesn't matter what kind of complications, whether you've had a leak, an infection, or just something has gone wrong somewhere, it hasn't closed properly. If during surgeries you've had some kind of obstruction in your bowels, or it's caused infertility or even chronic pelvic pain of any kind, it puts you all at risk. And also things like the complexity of your surgery, and any kind of complications during your surgery can put you at risk for adhesions. So it's not just about the after effect of your surgery, it's what happens during your surgery as well. So if the surgery becomes quite complicated for whatever reason, it can put you at risk for having adhesions as well. What I did find quite interesting is that 90% of women who have undergone gynecological surgeries lately, because it has increased, are now getting adhesions. It is beginning to become more common. It's a common occurrence now. Adhesions are becoming very, very common. Although it is important to understand that most adhesions, generally as a rule, don't affect people. It's not normal for adhesions to cause any issues. They just don't. Normally as a rule, they're just there. They occur, they develop, they appear, they're just there. They don't cause any issues, they don't cause any obstructions, they don't cause any pain. They just grow and they're just there. And most people don't even really notice them. And that's normal, you know. So there are hundreds of thousands of people out there with adhesions that probably don't even notice them or pay any attention to them, or, you know, it doesn't affect them at all. It's just how it works, because they don't cause any complications to their body, doesn't cause them any issues, they're just kind of there. So although adhesions are becoming far more common, they're developing a lot, you know, for a lot of people. Generally, they don't cause issues for a lot of people. If they do cause issues, they get something called adhesion-related disorder, and that's when they're in trouble. That's when their issues do kind of pick up. Now, I have this. I have had them removed once. Now, when I first had them removed, it took 2 years for the surgery, and by that time I was a mess physically. The amount of issues I was having was insane. I had a lot of gynecological issues, which is normal. I had a hell of a lot of issues. And when they actually did remove them, on my discharge papers it said that they were pulling on my organs, so they were actually moving my organs upwards. Not nice at all. Yeah, not nice. They do grow back very quickly, I might add. It's normal for them to grow back, which is why they don't operate every single time they grow back. There is more than one method to treat them, and depending on how quickly your symptoms develop, because symptoms can develop over periods of months or years. Depends on how quickly they do something about it. So the first time took 2 years. They tried a lot of methods to try and help me. That didn't work. And now they're back. And my surgeons said, no, not going to operate, not unless I have to. But the main kind of symptoms that we're looking at here are things like chronic pain, infertility, and other gynecological issues for women, like your menstrual cycles generally out of whack. It just is. There's not a lot you can do about that either. It's annoying, it's frustrating, and it's kind of hard work. Yeah, it's not nice. Things like bowel obstructions and the inability to pass gas. Don't ask, it's not nice, it's very, very embarrassing. Urinary bladder dysfunction. Very painful, don't like it, it's horrible. Pain and difficulty having a bowel movement. Things like this are extremely embarrassing. Things like this I don't like talking about. But you know, it is part of the condition. And it does make everything difficult, because you know that these types of things are embarrassing to talk about, but they have to be talked about. Because they grow as a general. They can grow anywhere in your abdomen and your pelvis. Mine specifically grow inside my bowel. Yay! Which is why my surgeons are very reluctant to touch me. After 5 surgeries, and you know, yeah, they don't like me very much. They don't like to just sort of, let's just operate and just keep operating. Yeah, it's not a simple thing for them to be doing. So yeah, and obviously they can't just keep operating on my small bowels. So yeah, they do have to be very careful. So yeah, it does cause a lot of obstructions in your bowels. And it does actually cause things like the inability to do anything else, for that matter. It makes intercourse very painful as well. For women, I don't know what it does for men, but I know that it makes intercourse very painful for women. It makes movement very painful, and we're talking about any kind of movement, so walking, sitting, or even laying down in certain positions becomes extremely painful for long periods of time. So you have to be really careful about how you move and how you do anything. It is one of those disorders, because of where it is, you have to kind of learn to understand how your body works, and you have to change a lot of things. It can also bring emotional disorders as well, because you become very aware of your body, and very self-conscious of your body as well, because of the embarrassing things this does to your body. And I'm assuming it's the same with a lot of other of the autoimmune conditions, you know. It can become very embarrassing, make you very self-aware, very self-conscious. It can also bring emotional disorders like depression and anxiety. It is extremely difficult to diagnose, because this particular condition doesn't respond to normal tests. You can't diagnose it with a blood test or any of the other normal scans, so no MRI, no CT, no X-ray can really none of those scans can actually pick it up. It just can't. You can't pick it up on the normal kind of scans that they do. And no blood tests can see it either, so they have to rule out everything. Any other kind of medical condition has to be ruled out first. And then when they've done that, they will go in, they will suggest a laparoscopy. Now, laparoscopies are horrible, and anyone who's ever had one knows this. But a laparoscopy will also, not only can it diagnose you, but actually it can solve the issue as well, because they can actually remove it, or remove some of it, sometimes. It can actually help remove some of them as well. Now, keyhole surgery is the only way to treat this. The only way to stop the symptoms completely is through surgery. Surgery is the best way to go. It's keyhole surgery, it's minor surgery, you can do it through a laparoscopy. It is a very simple surgery. It's keyhole surgery. They go in, they take it all out, and rah 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 rah. Bob's your uncle. You're off your feet for a week or so. It's day surgery. You know, it's no big deal. It actually isn't. But because they reoccur, you can't just take them out and that's it. Bob's your uncle. You're never going to get them again. Once they remove them, they come back, and they will regrow, and they will keep regrowing. Every time you remove them, they come back and they start growing again. So when they start regrowing again, they have to make decisions for themselves. You know, your surgeons, your doctors, they start making a decision for you and decide whether or not they're going to go back in and take them out again, or whether or not they're just going to leave you be for a little while. And like I said, I had mine removed 3 years ago, and then my doctors and my surgeons went, yeah, that's it, we're not doing you again, not yet, not going to do it. It's too dangerous for them to do it on me again right now, which is really annoying me, because the symptoms are getting worse and it's not good right about now. I'm having a lot of issues at this precise moment in time. But they won't operate on me that easily after 5 surgeries, you know, and they've come back, you know, they just won't. So there is another course of action that they will take. Once they've removed them once, they will wait their turn, and you'll just have to have another course of operations. So what they will do is they will refer you to a pain clinic. The pain clinic will assess you, and they will put you on pain medication. They will give you physiotherapy. It's a pain-related physiotherapy. Now, actually, of all the physiotherapies I've ever had, the pain-related physiotherapy is actually not too bad. It's actually one of the ones that I find fairly useful. Because actually it works a lot better than any other physiotherapy I've ever had, which has been useless. But pain-related physiotherapy is actually pretty good. It works. So through the pain clinic, you can get things like pain-related physiotherapy, and stuck on proper exercise classes for people with chronic pain and things like that. So through the pain clinic, you will get access to all sorts of things, including things like pain medication. And then you will need to change your lifestyle. That's the hardest part, I think, of all of it. And you will have to consider changing how you eat as well, because as the symptoms worsen, you'll find things like eating really difficult. Now for me, eating is here or there. I'm not a fan of food anyway. I've got mild slight eating disorder. So for me, I don't care. But for people with adhesions, going from like proper like eating like food, you know, you almost have to sort of regress a little bit, and it's better for you to be on like an almost liquid diet. And I said almost. Things like yogurts, smoothies, anything that's really easy to digest. So things like, you want it to be like nutritious and high in fibre and things like that, but you don't want things like steak and meat and loads of vegetables but I mean things like soup and yogurts and smoothies and even a stew. Things that are like really easy to eat but aren't like proper like meals where you like sit down and eat like a proper meal, something that's really kind of easy and like simple but almost not quite solid. It sounds ridiculous, but actually you will find that it's far more painful to eat a solid meal than it is to eat something that's almost liquid. I'm not saying you shouldn't eat anything solid, but eating high fibre, high whatever meal, solid, sort of sit down like you would with the kids and whatever else, steak, chips, whatever, won't help you because your body can't digest it all and your body can't get rid of it all. You just can't. And the more you try, the worse you feel. You just can't do it. Your body will just reject it all. You'll feel worse, you'll start feeling sick, you'll start feeling everything. Moving on to things like yogurts, soups, smoothies, stews, hot pots, things that you can digest really easily but aren't like solid and really kind of big meals, will actually help your body, and it actually helps sometimes break down some of the adhesions, which is really bizarre, but it does, or it can in some cases. But it is about sort of slowing down a bit. It's another thing you need to be thinking about. It's not kind of overdoing things, because the more you try to do, the worse you feel. There's a lot of things you need to kind of change while you're waiting for the next bout of surgery, so that you can kind of get back to some degree of normality, ready for when you fall apart again. But it isn't the nicest condition, because you spend a lifetime waiting for the next surgery. And then once you've had that surgery, you have to wait for the next one. So it's just an endless cycle of, when will the next one be, and how long will it take for me to feel like shit again, But, anyway, I'm going to go. Take it easy out there. I'll see you all later. Bye.